again, thank you for being out here today. Today is the first day of the Hypertension and Stroke Awareness Month, and I would first like to acknowledge our director for the LSU Health Stroke Program. Today is a day that we'd like to remind all of our patients that for any sign of stroke to please come to any of our emergency departments to be evaluated for this condition. But I would like to discuss another phenomenon that's equally concerning to us. We have noticed a phenomenon in this pandemic experience where we have a dramatic decline in the presentations of strokes and heart attacks and other emergencies that we customarily see. The American College of Emergency Physicians released a survey last week that indicated that 30% of the national respondents are actively not coming to the emergency department for fear of a COVID infection. We are all here to tell you that, first of all, your chances of dying from a heart attack or a stroke are much, much higher than they are dying from a COVID infection. And secondly, we want you to know that we have decades of experience at all of our emergency departments in treating people safely through other times of epidemics and other emerging diseases. So please, for the first sign of any emergency, whether it's a stroke or a heart attack, please call your physician, call 911, or again, go to any of our emergency departments to be evaluated immediately. And with that, I'd like to turn it over to Dr. Emily Nichols, who's Director of New Orleans EMS.
Thank you so much for inviting us. As the primary provider for emergency medical services within our city, at New Orleans EMS, we track several variables on the use of pre-hospital care. And we have similarly noticed a decline in the calls to 911 for life-threatening emergencies. In fact, we've seen about a 35% reduction in people calling with concerns for stroke and about a 50% reduction in people calling with concerns for heart attacks during the months of March and April compared to this time last year. And we do feel that it is directly related to the presence of COVID-19 in our community. In fact, our medics and our EMTs and I have all spoken with people who have specifically stated that they are fearful of using the hospital system or burdening the hospital system. And I do want to reassure everyone that we are taking every precaution necessary to help prevent the spread of COVID-19. Our ambulances are decontaminated after every patient and again after every shift. These are life-threatening emergencies. The same things that put you at risk of dying from COVID-19 put you at risk of having a heart attack or a stroke. Hypertension, diabetes, cardiovascular disease, those are all the risks to our community for all of these cases, and they should be taken very seriously. We pledge that we will do everything to keep our ambulances safe, and if you're unsure about whether or not this is an emergency, call 911. They have dispatchers that are trained in determining the urgency of your need for transport. And I would like to pass this on to Dr. Martin Shield, who will speak a little bit more about signs to look for these emergencies.
Medical Director for the Louisiana Emergency Response Network and LCMC's primary stroke centers, Toro Infirmary, and New Orleans East Hospitals. My team educates patients every day about the treatments that are now available that have been proven to reduce long-term disability and dependency after a stroke. But every minute matters. These treatments are time sensitive. That means that with every minute that passes, the effectiveness of our treatments goes down. Don't compromise your forever function by fear of being in the hospital. For any signs and symptoms of stroke, please dial 911. Our EMS agencies are prepared to protect you as they rapidly respond to your emergency and deliver you to the hospital that meets your needs. And our emergency departments and hospital staff are prepared to protect you from acquiring infection and adequately evaluating and preparing time-sensitive treatments, and then subsequently rehab. Please know that the signs and symptoms of stroke most commonly experienced are any sudden loss of vision, any sudden loss of balance, any sudden weakness, numbness, or clumsiness affecting one side of the body, or any problems communicating effectively, any of those symptoms is a stroke until proven otherwise, please dial 911 and trust that we're here to protect you and take care of you. I'd like to hand it over to Ali Simone.